Right. He remarked on my introductory comment about it being a passive modality, and he was quick to help me understand that he does not treat it as a standalone intervention or procedure that's not accompanied with neuromuscular reeducation, with therapeutic exercise, that type of thing, with maybe some manual skill as well. So I thought that was important to note that, okay, if and when a person decides to utilize that procedure, that those that would, are probably more knowledgeable about it, they would definitely couple that with an active approach. And so, in some respect, perhaps it's not so locus of control away from the patient as maybe I was thinking of it.
Yeah, and I thought that was a good question on your part and a good answer on Joe's part in that it's not in isolation.
Yeah.
When done appropriately, it's not in isolation. When we look at clinical practice guidelines in people getting on physical agents as being inappropriate or not, well, when they're used in isolation, they're not found to be effective. When used in combination with active exercise, more effective.
Mm-hmm.
So whether it be moist heat applied and we're using stress relaxation to elongate the joint capsule, or whether it's, ice and electric stim to break through that pain, then you follow it up with active exercise. Joe talked about muscle reeducation patterns and right following that treatment. So again, it isn't, and that I think is unknown to some people who are critical of that approach. It's not just dry needle the person and send them on their way. When done appropriately, it's in combination with other interventions, the primary one being active exercise.
Mm-hmm. Ron, in what respect or what did Joe say that you have most significant of an issue with? Anything that you felt like, nope, I'm definitely going to call you out on that, or differentiate my opinion different from his?
You know, I was skeptical, in hearing Joe's presentation and talking about the active versus the latent trigger point, what's relevant and what's maybe underlying, was very impressed. He talked about locus of control, and that I think was a point that you were bringing in that certain people, even if they have an internal or excuse me, an external locus of control, breaking through that pain barrier, and I would not necessarily have any issue with any of the things he said. I was actually very, very impressed. And I know Joe's an impressive researcher and clinician and professor. So, I think, and he brought this out, and I was impressed by this as well, is that we not only have to use testing examination of the patient to decide who's appropriate for something, but also use it to determine who's not appropriate.
Mm-hmm.
So he also taught using to address the alternative hypotheses. And I know I've been guilty of using pattern recognition and going to what immediately I think is going to benefit the patient and skipping over certain components that may or may not be as relevant to the present episode, but may be a factor in the future. So, and the only big difference I think is where we would place the emphasis in our exam.
Mm-hmm.
So my emphasis is early on the patient self-management, correction of posture, finding directional preference, exhausting the potential for directional preference, and less as we get down towards palpation, where I would guess that person who's trained in dry needling, that is higher up in the examination sequence
Mm-hmm.
and probably emphasized to a greater extent.
Yeah.
But that's just training and exposure and seeing what works, and we find what works with our patients, we tend to stick with it.
Yeah.
And he's finding success, or he wouldn't have stuck with it. He's had training in many different schools of thought. He probably would have gone on to something else. So
Mm-hmm.
um, I think he brought up some things we all need to keep in mind. The other thing he brought up that I want to say is that we can't keep bashing other people's approaches.
Yeah.
And if we bash dry needling, we don't have an understanding of it, then there's no place for that. Just like I've heard People refer to McKenzie as pressing guests. I've heard at a muscle balance course, you manual therapists just get high on your joints. I've heard the extension patients today will be your stenotic patients of tomorrow. That just reflects people don't understand or appreciate, what has its proper place. And if you are selling a good product, you don't need to bash anything else, right? So you don't hear Audi making commercials about lousy cars, right? So, I think that is a message I've heard him say before when he got a national award from the APTA, and he said that again, and I can't agree with him more. So we have a great product. We don't have to knock anything else. In fact, probably be helpful for us to learn a little bit about these other things. I mean, he caught my interest with some of the things he mentioned.
So yeah, which dry needling course are you going to take? Maybe we can take the same one, Ron.
Well, I'm not opposed to it. I would be interested in it. I'm not signed up yet, though. So
maybe the one that Joe teaches.
I would do that.
All right. Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.